veterinary surgeon practicing in the UK, and today we're going to be talking about osteoarthritis in dogs. Osteoarthritis is the most common type of arthritis, with 1 in 5 dogs in the UK affected. It's so common that when most people mention arthritis in dogs, they're actually referring to osteoarthritis. It's also known as degenerative joint disease because that's what it is. I'll insert a picture of a joint here so you can see what one looks like. But essentially, there's lots of different structures within the joint which help the two bones smoothly glide over each other, including the cartilage and the fluid inside the joint. In osteoarthritis, all these structures are degenerating and becoming more and more damaged just with normal movement from the dog. Dogs can also get osteoarthritis from incorrect growth of their bones, so they just grow funny, but we're going to ignore that one today. So with this condition, it can actually be quite hard to tell that anything's wrong because most dogs are quite stoic and they will hide pain really well. I say most dogs because I used to have a greyhound and she told me very dramatically when there was something wrong with her. So most dogs are stoic. You may notice, however, that your dog starts to slow down. Maybe they're not running as much as they used to, they're not jumping on and off things as much, or maybe they're a little stiff when they wake up in the morning, and then after a few minutes they're fine. A lot of people will put this down to just normal aging. They're getting older and, old dogs are slower. But think about this for a second. If a dog is feeling just as fit and healthy as it was a year ago or 2 years ago, why would they slow down? Wouldn't they keep moving just as they have as before? It's really important to consider whether your dog has slowed down in the last few months or few years, because it's something that can happen so slowly that you don't realise it's happening. It really depends on the dog and the client, so the best bet you have is to talk to your vet, but today I'll just generally talk about the prescription options and alternatives as well. Number 1, NSAIDs. NSAIDs is an acronym and it stands for non-steroidal anti-inflammatory drugs. It's a long name just to say it's a drug that reduces inflammation in the body and it's not a steroid. In this case, we're using NSAIDs to reduce the chronic inflammation that you find in the joint. When there's damage to a joint, it causes inflammation, and this inflammation can be painful and cause its own problems as well. Some examples of NSAIDs would be ibuprofen in humans. We don't use ibuprofen in animals because it's toxic, but an animal example would be meloxicam, which you might have been prescribed for your pet before, especially if it's had surgery such as neutering. It might go home for a few days on meloxicam or a similar NSAID afterwards. These are a very important class of drugs and it's often our first choice. Reducing that inflammation gives really good pain relief. The only issue with NSAIDs is there's quite a long list of animals that can't use them. For example, those with kidney disease, because if a kidney's not functioning well before NSAIDs, it can actually make the kidneys worse. The next group of drugs I'd like to talk about are disease-modifying osteoarthritis drugs. It's a long name, DMOADs. These are a relatively new class of drugs, which means they have much less research behind them, but the research that has been done so far, they seem to work pretty well. They are supposed to reduce the breakdown of cartilage in the joint and promote synovial fluid, so the fluid inside the joint there's supposed to be more of it, which helps the joints move. They are also very strong anti-inflammatories, so they will have a pain relief effect as well. There are many other painkillers from different classes of drugs, which I won't be mentioning here, but definitely have a place in treating chronic pain, such as in arthritis. If you want a detailed video on chronic pain drugs, I'm more than happy to do that. But there's quite a few, so I won't go into them in detail here. Lastly, I should mention that surgery is an option if it's in your price bracket, but only for certain dogs if they're a good candidate for surgery. Not all of them are, and which joints are affected, because not all of the joints that can get arthritis can be surgically treated. So now I'll talk about alternative treatments. I love the fact that there are other options out there that aren't just prescription medicines, but I hate the fact that they're called alternatives, because they're not really an alternative. They are a complement to prescription medications, and they can even help reduce the doses of those medications, which is always a good thing. First on our list are chondroprotectants, which means they protect the cartilage, because chondro means cartilage. These are drugs that are supposed to slow down the degeneration of the cartilage, which is one of the parts of the joint that help the bones move smoothly over each other, but they're not anti-inflammatory, so they don't have any pain relieving effects themselves. They just are supposed to slow down the progression of the disease. Also, if the joint is already really severely affected, there's often no improvement. These drugs usually contain a lot of natural ingredients such as omega-3s, vitamin E, glucosamine sulfate, green-lipped mussel, and generally have very few side effects. There are a few good studies which support their use. I can send those to you if you're interested, but it's important to remember that every dog is an individual and they will react individually, and I will stress that in every video. One dog may get on really well with them and see a huge improvement, and other dogs may not respond at all. Generally, if nothing's changed in a couple of months, then it's probably not going to do anything. Advice on which ones to try, how often to give it, you know, the details, then it's best to speak to your vet. Now, I know there are many supplements on the market that claim to help with arthritis in dogs, and I'm not here to tell you don't try them. I'm just here to say, please do your research first. If a drug doesn't list its ingredients and just says it's a herb blend, then it can potentially be dangerous, because you don't know what you're giving your dog, and just because it's natural doesn't mean it's not dangerous. Cyanide is natural, but I don't see everyone taking that on a daily basis. Also, if they claim to treat every disease under the sun, then it's probably too good to be true. I would recommend that if you're going to try a supplement, that you speak to your vet first. They may have come across it before and know if it's good or bad, but at least let your vet know that your dog is going to start taking it, so they can put it in the health records, and so if something bad does happen, that they know. Enough of that lecture, let's move on. Next is laser therapy. Painless, non-invasive, and it's supposed to be anti-inflammatory, which, as we have figured out by now, is pain relieving. Response to this treatment depends on the individual dog, but there's been some really good positive results in the research, so I suspect it will become more and more popular as more research comes out, as it is still relatively new. Acupuncture is another alternative treatment for osteoarthritis, based on some rather old research now. 60% of dogs in their trial responded positively in pain relief terms to acupuncture, mainly of hip, shoulder and elbow joints. It's not the most convincing research I've read, but it is an option and it may or may not work. Hydrotherapy. Hydrotherapy can be a really good option because it keeps them active while letting them exercise in a way that takes some of that pressure off the joints. And it can also help with dogs that are slightly chunkier lose some weight in a way that doesn't stress those joints out. So I've discussed a lot of alternative treatments and prescription medications, but what are some things that you can do at home to help your dog? Now, I'm sorry to be the bearer of bad news, but as adorable and cute as fat dogs are, it does put more stress on those joints and causes them to degenerate faster, so they'll get worse quicker. Usually your local vet nurse can actually help with a bit of a diet plan just to safely lose that weight, and hydrotherapy, as I've mentioned, might help. So yes, as cute as your little chunky monkeys are, they might need to lose some weight. Exercise. Now, it's best to keep them exercising, but something that's really important is to keep their exercise consistent. So if during the week you take them on, I don't know, 30 minutes, 45 minutes a day, and then on a Saturday you take them out for 5 hours a day, that's not very good for their joints, because that one walk they're not actually used to that level of exercise. So it's best to keep their exercise consistent. While that's a major generalisation, you get my point. Keep exercise consistent. There's also things you can do to help your dog getting around the house. For example, raising their food bowls so that they're not bending down as far and putting more strain on their neck, which is a common place to get arthritis and causing a bit of pain. Other things include buying a ramp to help them get into the car instead of having to jump up and down into the boot, and orthopedic dog beds as well, so they have enough padding while they're asleep, so they're a little bit less stiff when they wake up. These sound like small things, but they can make such a difference to the course of a dog's pain throughout the day. There are other treatments that have been suggested for osteoarthritis, many, but I thought I'd go through the common ones today. Just because osteoarthritis is such a common condition in dogs doesn't mean that the chronic pain these dogs are going through should be downplayed. There's lots we can do about it, and they can live out their golden years as pain-free as possible if we keep on top of it. So I hope that was helpful. Please like and subscribe if it helped. Yeah, I love making videos on pain relief and anaesthesia, as you know, so, ask away. Thank you.